Cynthia said, I'm a family physician, and I also am currently being treated for pulmonary cavitary tuberculosis. Pulmonary because it's in my lungs, and cavitary because of the holes that the TB has made inside. The biggest of which is about the size of a golf ball, right here. You guys probably don't suspect that my face is the typical face of TB, because in addition to having an affinity for the lungs, TB goes after people pushed to the margins. It goes after our community members who are in crowded housing situations, in shelters, because of lack of affordable housing and low wages. It goes after people who happen to be born in countries without health infrastructure and regular primary care. So in many ways, I'm not necessarily the right person to be here talking to you all about TB, because my face is not what you think of. And yet, all of our faces are in all of our community members who have tuberculosis. I'm an educated white kid from Westfield, Mass. And since we're in Boston, you guys have to know that's a faraway land outside of Route 128. I don't even think you can take a car there. It does exist. And again, you just don't think of seeing somebody like me in that situation, but in addition to TB going after poverty and attacking in that way, TB is also airborne. So your risk factor, and not droplet, like those disgusting flu posters that UPH gives us, that show droplets everywhere, which is very important to know when they do. But it's not like that. It's airborne. So my risk was breathing. Right? That most essential part of human existence, breathing, is how it comes in. And that's how it's spread. So I'm very lucky. When I was treated down the street, small little hospital on the river, 7 months ago, I was in a negatively pressurized room so that even the air that I breathed could not leak out into the hallways, with a double air locking door. The wonderful nurses and physicians who took care of me, I don't even know what they look like. They all had masks on when they came in. The housekeepers who came in and talked to me, probably not as much, or much longer than they would have liked. Like, oh, a human being, please talk to me. I don't know what they look like. And in that space, I'm very lucky that I have that there. I live in a commonwealth just by nature of having to be born here that values health infrastructure, that has a Department of Public Health, that has primary care, that can get me the medicines, that can test the strains that I have to make sure it's not drug resistant. I have access to clean water and nutrition, and that's just all granted. And yet, I am 7 months into treatment. I still take a handful of what my son calls plugs every day, and I still sleep 12 hours a day. I have cut down my work as a family physician, my love, my passion to part-time. I have stopped taking medical students. I don't really ride my bike much, and I sleep all the time. My wife, Emily, who was never expecting a healthy young person to see her husband more often asleep than awake. And I think if she wanted a job at DPH, her directly observed therapy is much more fierce and much less compassionate than any of you guys. But I have that. I'm not living in a makeshift shelter or living incarcerated or without access to food. And I still am having all these challenges. I still had to cover the rifampin in peanut butter and try to trick my son into eating it for 3 months while this medicine made him cry orange tears. this illness completely turned my life on its head. And TB is airborne and it's everywhere. It's asleep in our bodies until it's not, and causing a tremendous problem. So that's why we need the surveillance. That's why we need everybody here. I think about, get to the privilege of taking care of my youngest patient right now is a month old, my oldest is 98. And that's just, it's such a joy, and yet in the months after I was diagnosed with a deadly, infectious, contagious disease, it was Hannah and Deb and my medical director, Scott, who were tracking down 1,000 patients, 300 of which were kids, putting them on medication. They know more, the citizens of Lynn know more about TB exposure than they probably ever wanted or certainly planned on. And I had to not worry about that at all because my colleagues took care of it. So I could focus on getting better, swallowing these handful of meds. Michael Malone is a public health nurse, many of you know. He's the one who came to our house and explained to Emily and my son Hunter what I was doing and what was going to go on. He's the one who took the phone call from the panicked neighbor who took a sip of my water bottle 2 years ago, who needs a PPP. But it's that level of education that the public doesn't have. That's what you guys do. And so how do you balance educating a public who is terrified that, yes, you need to be afraid, you need to follow up, and yet not isolate the patients so we feel like we're just locked away. And that's not science, that's the art that you guys all do. And we need to, as Commissioner Burrell says, we need to just get rid of this because it's not just people in other countries. And even if it was, it should still be our focus. But for those who you can't convince with that argument, for those who you can't convince that the individual in the shelter is just as human, the person forced into the margins is just as human, malnourished are just as human, if that won't convince them, then tell them you saw an educated, healthy young person who is just the same, and the illness doesn't care, TB doesn't care, and it'll do this no matter who you are. So unless it's a person who doesn't breathe, you can tell that person that they need to pay attention. And with multi-drug, the medicines I'm taking, no offense to public health, are terrible. They're terrible. And I have to get liver tests to make sure that they're not, I know it's important medically, I took that class, but I never really paid attention to ordering lab tests until I got so many of them. And I'm like, geez, I tortured my patients during residency. I never should order that many lab tests. Doctors are horrible patients. I mean, these medicines are awful, and these are the ones that are cheap and easily accessible. If I had multi-drug resistant TB, the treatment is much worse, and it's much scarier, and the contacts are in much higher risk. So all of this meant a lot to me before. These are my people. This is what I committed my life to. But I didn't want this to be my understanding of what my patients are going through. But here we are. So thank you.